We are back with Dr. Olu Jegede talking about living life with sickle cell. So we're going to jump into our next question here. Why does someone with sickle cell need a regular provider, and why are regular check-ins so important even when the person feels okay?
Yeah, thanks for that question. The damage that is caused by sickle cell in the blood and the body, some of them happen silently. So the patient may not even know, and they may be having kidney problems, because chronic, that is having this blockage into the kidneys, may be making the kidney to fail. So we want to make sure that every patient is screened and monitored for their kidney function, monitored for the risks of developing stroke and even some lung health issues as well before their symptoms even appear. It is also time to adjust medications and check in with their emotional status. We just want to build trust with our patient. We want to maintain good relationship. So it is great to come to the doctor. I see my patient once every month who need to be seen. Not that they are sick or anything, but because we have to monitor those things going on. At the patient care center, we also have other providers who see our patients, and they see them more frequently than those other than people who don't have sickle cell disease.
Yeah, I'm sure those check-ins are important. This next question, sickle cell disease is a lifelong condition. Talk about the transition from pediatric to adult sickle cell care and what families should know to help make it a smooth transition.
Yeah, I mean, this transitional period is a vulnerable time for our patients. As a pediatric patient, they have a lot of support system and they've grown up now. So they have a little bit of independence and it is scary. It is scary. So at home, what we do is partner with our pediatric team to have a warm handoff. And we start that around age 16. So it is not just at once you are now an adult and then you have to take care of yourself without support. So we have that age that we transition between 16 and 18. We invite them to come to our clinic at the patient care center. We introduce them to our providers, making sure that they ask all their questions. The parents are present, and we're able to help them. When they are now 18, the transition is easier. And then we know their medications, they know what we do. They can even use our day hospital from age 16 and above. So it is about providing that continuity, giving our patient the confidence and the connection that they need.
Absolutely. I want you to talk about, ways to take care of your mental health while also managing the physical symptoms, if you can.
Yeah, I'll tell you, the emotional burden is real for our patients. Having chronic pain since the time you were born, the fear of being judged when you go to health system, missing school or work or can't even work at all. And this will give anyone anxiety, depression, isolation. They feel depressed. So what we do is to support our patients. We have medical social worker who can provide counseling. We refer those who are really struggling to psychiatrists as well to be able to help drill down. But I think the most important part of the mental health impact is family support. Support the family, showing them empathy and making sure that they are understood. We want our patients to know that you are not alone. If you are facing all this or you have anxiety, depression, please call us. We are here to help.
And jumping into the family and the friends and support systems, what are some specific things that they can do to help support their loved ones who have sickle cell disease?
First, I would say just be informed and know what sickle cell is all about. Because when you have somebody always complaining of pain, it gets to a time that you think they are making it up. But really, this is real. So, most of all, I want them to believe when they say, I am in pain, they are in pain. Show some empathy and encourage them to stay engaged, ask questions, come with them to the appointment and ask all your questions from your provider. They'll be able to help you understand the disease even better. And then you can show more support with your loved ones.
Absolutely. Well, thank you so much for your time and all of that great information. And remember, if you missed this entire segment, you can find it on our website, WFMYnews2.com.